On this edition of Veterans Health Watch, we'll learn about VA healthcare services and benefits offered to returning veterans from Iraq and Afghanistan.
We'll also learn about the VA's vocational rehabilitative services offered to veterans.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland Healthcare System that provides the latest health and benefits information to Maryland's veterans, their family members, and the local community. I'm David Edwards.
And I'm Kenya Griffin. I'm glad to be here for today's show, where we'll focus on the VA Maryland Healthcare System's commitment to veterans returning from the wars in Iraq and Afghanistan. And joining us to give us more information on those services is Chris Buser, the Healthcare System's Clinical Director of Post-Deployment Health and one of our regular guest hosts. It's good to have you here on the other side, Chris.
Yeah, it's great to be here. I'm enjoying this.
Well, I understand that about 17,000 veterans have enrolled for VA healthcare system since the war in Iraq and Afghanistan have started. Could you tell us about the free health care available to these veterans who suffer from certain injuries related to service?
Sure. As you mentioned, we have about 17,000 veterans from the Maryland area who are enrolled with us. And one of the great things that we can offer is cost-free health care to any veteran who's deployed to Iraq and Afghanistan. And that's for any issue they feel is related to their deployment. So if they've come back and they have sore backs, sore knees, sore shoulders, maybe even that they're having some difficulty with readjusting emotionally or mentally, maybe they're having some nightmares, difficulty sleeping, maybe even some relationship problems with their spouse and family. Those are all things that we can take care of at no cost for the first 5 years to them. Also, during their first 180 days off of active duty, we can take care of any dental issues that they might have. I know, dental insurance is something a lot of people don't have, so having that access to dental care so early after your service is a wonderful benefit. And then we offer a wide array of services like primary care, orthopedics, OT, and PT, and also programs for our women veterans as well.
Chris, you've kind of given a nice overview of the healthcare services available for returning veterans, but can you talk a little bit about some of the specialized VA programs and services that were put in place to deal with this very unique population?
Sure. So, in addition to the wide array of services that all veterans can receive, we do have a seamless transition office which works with our most seriously ill and injured veterans who are coming out of military treatment facilities like Walter Reed and Bethesda. So we offer case management services to veterans who have, complex injuries or may have difficulty navigating a healthcare system. We also offer primary care clinics that are designed to focus on returning veterans. We offer those at our Baltimore site, and also at our new Fort Meade clinic we offer those clinics. And then we have some additional services where we offer programs dealing with multiple injuries, what we call polytrauma, and also traumatic brain injury services. And then, of course, focusing on the mental health and emotional needs of our veterans. We've hired staff specifically to provide services and outreach to veterans dealing with mental health concerns that they might have.
Well, Chris, you mentioned traumatic brain injury, which we've heard is one of the signature injuries of this current conflict. Could you give us more specific information about the services that the VA provides for TBI?
Sure, yeah. TBI, or traumatic brain injury, really is the signature wound of this war. It's existed in all the wars, but because of the use of the improvised explosive devices, those IEDs that we hear about on the news, many of our veterans have a level of traumatic brain injury. Could be anywhere from a mild to a severe. And services for that really start with recognizing it. So it starts with screening. So in those programs like our post-deployment health clinics at Baltimore and Fort Meade, we're specifically screening all of our returning veterans for things like traumatic brain injury and post-traumatic stress, asking them questions about, were you exposed to a blast? Did you have any falls? Did you ever strike your head? Were you in a motor vehicle crash? So screening for that is the first part of treatment. And then once we've identified someone who might be at risk, we do have a traumatic brain injury program where we bring the veteran in for a more specialized screening where they meet with a physician, go over a battery of questions, get a physical exam. We can also do neuropsychological testing to find out if there are certain parts of the brain that have been more affected than others. And based on those findings, then we can put together an individual rehab plan designed, to kind of help the brain rebound and put in supports in place, so they can regain as much functioning as possible.
Chris, I know we've heard a lot about some of our veterans who've returned from Iraq and Afghanistan with significant serious injuries, and I know that that becomes very taxing for family members and caregivers. Can you tell us a little bit about some of the VA programs that are available to assist these family members and caregivers of severely injured veterans?
Sure. I'm glad you mentioned, the family members, because there's a caregiver study that was done, and we really find that about twice as many caregivers of veterans suffer issues than do caregivers of non-veterans. And the VA has historically offered programs that are available to help veterans and caregivers. There's about two dozen different programs, like our respite care and our home health aid programs. But the President signed an omnibus health bill about a year and a half ago, which allows us to provide more services to the caregivers of veterans who were injured after 9/11. And some of those enhanced benefits that we can now offer are a stipend for our caregivers to help them financially. Caregiving can take a toll. We can also offer Chant VA, which is an insurance program to family members so that those caregivers can get their health needs taken care of. About 23% of caregivers have health that's kind of only fair to poor, so there's a definite health effect of being a caregiver. We also offer mental health services and counseling to our caregivers, and those are things that we never had before a year and a half ago when the new legislation was signed.
And Chris, I know it's not uncommon for veterans to have difficulty readjusting to civilian life after serving combat time or even time in the military. What services do you provide to help those veterans readjust, and what are some of the stress symptoms you notice?
Sure. With this current group of veterans, we see a lot of vets who have deployed multiple times. With our Vietnam population, they typically served 1 year in combat, and that was their only combat experience. Certainly others did serve longer, but typically it was just one time. With this current group, I have many veterans who have served 3, 4, I even have one female veteran who's been over 6 different times. So they have a lot more exposure, which brings on a different array of symptoms, or sometimes a more intense array of symptoms. So veterans and their families might want to look for someone who's seen some changes in the veteran's personality. They may be a little bit more withdrawn, they don't come out as much, may even seem a little bit more secretive. Some basic things that we see are even changes in their driving habits, because most of the time that our soldiers are at risk is when they're on the road. That's where those IEDs are located. So they may drive a little erratically, they may speed a little bit, and they may just generally act like they're still in a combat zone. So those are some of the things that you might want to be aware of, if you're a veteran or a caregiver of one.
Chris, can you briefly talk about the post-deployment health reassessment program? I know this is a very important program that the VA Maryland Healthcare System started hosting several years ago for Maryland National Guard and reservists. Can you tell us what veterans can expect when they're attending this, and what are some of the services they can take advantage through this program?
Sure. This is actually a partnership between the VA Maryland Healthcare System and our local Department of Defense agencies like the Maryland National Guard and Reserve units. And last year we did about 25 different outreaches. We talked to about 2,200 veterans and their family members, so it's very successful for us. But what goes on there is there are classes for our veterans to help them recognize some of their symptoms. There's also classes for caregivers and family members. And then we bring the veterans back about 90 days after they've returned from overseas, and we ask them about their health status. How are you feeling physically? How are you feeling emotionally? Have you noticed any changes? And when they come into the medical center to do this evaluation, we have an opportunity to enroll them for care. We can schedule them for their first appointments to meet with a doctor or a mental health counselor, and we can also start some of those screens, like I mentioned, for traumatic brain injury. So the veterans are really getting a point of service care when they come in. They get education, they get enrollment, and they get scheduling, all within the first 3 months of coming out of active duty.
Well, Chris, we're going to take a short break soon, but if you could just tell us some of the more overall services that are available to veterans aside from the direct mental health services, and how they can contact you if they need more information.
Sure. We do offer some other services. We have a life enrichment program that veterans will be very interested in. We also have My Healthy Vet, which is a way to have an electronic access to see some of your medical records and also to communicate securely via an email type of communication with your provider. So that's really important. And of course, veterans can reach out and call us. You can use the telephone number that's on the bottom of the screen, or also our website if they have any questions and would like to reach out to us.
Chris, thank you so much for joining us today. I really think our viewing audience learned a lot about the services offered to returning veterans throughout the VA Maryland healthcare system. We're going to take a short break, but when we return, we'll be learning about some of the medical services available to returning veterans throughout the VA Maryland healthcare system.
We're proud of the services that we offer to veterans returning from conflict.
The VA has case managers, both social workers and nurses, who are experts in helping them transition from the military into the VA system.
We make sure that they are aware of all the services that are offered to them.
We're getting them almost right off the battlefield and into the type of care that they need. And this is different than what we've ever done for any other war era.
The VA was very proactive. It does make you feel like you're getting top-notch quality care.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.
Welcome back to Veterans Health Watch. We're now being joined by Dr. Michael Corcoran, a physical medicine and rehabilitation physician with the VA Maryland healthcare system, and James Ferris, a returning veteran from both Iraq and Afghanistan. Thank you both for joining us today.
It's an honor to be here. Thank you.
Thank you for having us.
Dr. Corcoran, in our previous segment, we were talking a lot about traumatic brain injury with the returning veteran population. But can you tell us what are the most common things that you're seeing with this population?
Well, traumatic brain injury is called the signature injury, but it's certainly not the most common. It has a frequency of about 10 to 20% in returning veterans, depending on the study that you're looking at. By far, the most common injury is musculoskeletal injury. Musculoskeletal injury can, the definition of that is injury to muscles, tendons, ligaments, joints, and supporting structures around those.
And Dr. Corcoran, could you tell us what musculoskeletal disorder is and why is it so prevalent in this generation of veterans?
Well, musculoskeletal disorder is just a diagnostic grouping for any number of diseases, from back pain to knee pain to myofascial pain or muscle and fascia tissue pain. And the reason that it's more common are several. Oftentimes the pain actually starts before a veteran ever is deployed. In basic combat training, there's approximately 50% incidence in female veterans and 25% incidence in male veterans of musculoskeletal injuries being reported. 80% of these occur in the lower legs. Within that group, there are some factors that predispose a person to injury, or maybe not predisposed, but are characteristic of someone that's going to report an injury. A high body mass index, being overweight. A low aerobic capacity, just being out of shape. Summertime seems to have more injuries than in the cooler weather. So those are some factors there. Secondly, during the recent wars, the survivability has improved dramatically due to body armor, improved field techniques with tourniquets and other techniques, and evacuation to skilled medical care that are saving veterans, so that 90% of severely injured soldiers are being saved. A lot of these soldiers have chronic conditions then that produce pain that we see after deployment to treat. Third, soldiers carry a huge amount of weight on their backs. Between the rucksack, the weapon, and their body armor, they could be carrying over 100 pounds. They're running, they're jumping, they're falling, they're being bounced around in the vehicle. All these things are putting excess stress on joints that weren't designed to do that.
You mentioned pain. Can you talk about the relationship between pain and psychological distress?
There's a very high rate of psychological distress and mental health conditions in returning veterans. PTSD being the number one, followed by depression is a little bit further behind that, but there are a couple others in between. Mental health conditions augment the pain response and increase the intensity of the pain experience for a veteran.
And what about some of the long-term effects of chronic pain? You mentioned that some veterans or some soldiers start experiencing these issues even before combat, then you have time after combat. So what are the long-term effects of this chronic pain?
Well, the further from deployment that a veteran is, the more likely he is to report a musculoskeletal injury. The rate of chronic pain is fairly high in returning veterans. About 50% of veterans will report mild chronic pain. About 30% of veterans will report moderate to severe chronic pain issues. There's another 30% or so that have what's called chronic widespread pain, which is pain over multiple areas of their body. The outcome of that is just generally poor physical functioning. It can increase the risk for mental health disorders as well, particularly substance use and misuse of narcotic pain medication.
Pain, I'm sure, is, since you mentioned this, a very concerning issue for our returning veteran population, and I'm sure there are a number of treatment options that are available through the VA Maryland healthcare system to treat pain. Can you tell our viewing audience a little bit about some of them?
Yes, I think the VA does an excellent job in addressing the needs of veterans with the programs that are in place and the programs that are being planned. The primary care provider is the gatekeeper for the VA, and that's the model of the VA currently. The primary care provider can decide whether or not he feels he's comfortable or she's comfortable enough with the pain to treat it on his or her own. So if it's a knee pain, that a non-steroidal anti-inflammatory or a Motrin or those type of medications can handle, then they can manage that pain. Oftentimes the pain is more severe than that and doesn't respond to those initial interventions. The primary care then has the ability for special referral, and there are a host of specialists through the VA, from neurosurgeons to neurologists to orthopedists to orthopedic surgeons to rheumatologists to my specialty, physical medicine and rehabilitation.
And we mentioned earlier that we have a veteran here. James, thank you for joining us.
Thank you
Who served in Iraq and Afghanistan. Could you tell us a little more about your military service and what led you to seek care at the VA Maryland healthcare system?
Well, I've completed 16 years of service. I did 4 years first in the United States Marine Corps, and then I transferred over to the United States Army for 12 years of that. While I was in Fort Polk, Louisiana, I was with the Warrior Transition Unit, and they pretty much gave us the guidelines for how to use a primary care manager, how to use other programs that are available. As soon as I got out, I sought my primary care manager automatically. From there, she gave me consults to see Dr. Corcoran, to see occupational therapy, to see speech therapy, to see physical therapy, and on from there. I basically needed the help because I can't do it on my own, and I needed some help somehow.
Great.
James, and can you tell us a little bit about how the VA Maryland healthcare system has helped you cope with both your physical and mental issues after coming back from both Iraq and Afghanistan?
Yes. Like I said before, I'm with Dr. Corcoran, and he does acupuncture therapy with me. Sometimes it's local, where it's just right there in the spot, or sometimes it's the battlefield studs, which I'm currently wearing now. That's for the muscular spinal issues that I have. As far as my mental health goes and my PTSD, I seek help through the VA centers at Dundalk. I also come to groups every now and then at the VA hospital on Green Street, and but most of my behavioral health is taken care of at Dundalk.
And could you tell us if there's anything now that you're able to do that maybe you weren't able to do before you started seeking care, or how your life has improved after receiving the care through the VA?
Yeah, with the care from the VA, most of my my ailments was lower back, knees, ankles, and some shoulder pain. But through the acupuncture and through physical therapy, I'm able to do more household chores. Now I'm able to put my boots on without having aids. Picking up my daughter, going out and play with her, play with my dogs. stuff like that I'm able to do. As far as the behavior health goes, I'm still working on trying to get out into the public and just deal with that whole hermit concept.
So what would you tell a veteran or share with our audience if you have some final words that you'd like to share about the VA or about just seeking care?
Well, the only thing I can say is if you know you have a problem or if you know something's different, automatically seek help. It's just like if you were taking your car or if you're driving a car, you know how your car sounded when you took it off the lot. And if it doesn't sound right, you're going to take it into a dealer or to a mechanic to look at. It's the same thing with your body. If you know something's not right with your body, you'll know, and just go ask for help. I mean, the sooner you ask for help, the better you're off.
Can't make it any plainer than that.
Exactly. And Dr. Corcoran, how about for you? Or if there's anything you would like to leave our viewing audience with today about what they should know about the services available through the VA Maryland healthcare system?
Well, there is a model that's evolving called the biopsychosocial model of treating pain. That involves a primary care doc as the gatekeeper, mental health, and social work. Bio for body, the injury that the veteran has sustained. Psycho for the mental aspect of dealing with the pain. And social because pain doesn't happen in isolation to a veteran. He has a family, he has a community that he interacts with, and it's important to coordinate that aspect of care into the picture.
Dr. Corcoran and James, thank you both so very much for joining us today. I think this was a wonderful segment, and hopefully our viewing audience has learned a lot.
Thank you.
We're going to take a short break, but when we come back, we'll be learning about vocational rehabilitation, so stay tuned.
If a veteran is experiencing any type of mental health problems, they should realize that they're not alone.
One of the things that we can really help with is kind of giving them the education to help them face the issues.
Hiding and keeping secrets was the very thing that was keeping me sicker.
Trust me, you're not by yourself. If no more than to know that I'm in that same category.
Saved my marriage, made me feel like a person again.
I couldn't have gotten this far without the VA.
Welcome back to Veterans Health Watch. Joining us now is Laverne Harmon, a supervisory vocational rehabilitation specialist for the VA Maryland healthcare system. Laverne, thank you for joining us today.
Thank you for having me.
I understand the VA provides an therapeutic supported employment services program, and I'm sure our viewing audience would like to hear more about this program and how it benefits our veteran patients.
Yes, David. The VA Maryland Medical Center does in fact have a therapeutic supported employment services program. It's primarily focused through our compensated work therapy program, which is a recovery-oriented vocational rehabilitation program that strives to match and support veterans with community employment. There are 3 compensated work therapy programs that are provided at the Maryland VA. The first is our supported employment program, which is our clinical model, and that assists veterans who are diagnosed with serious mental illness or physical impairments co-occurring with mental illness, which enables them to find meaningful employment, part-time or full-time, in the community with supports or workplace accommodations. Then we have our transitional work program, which is a time-limited program which enables veterans to obtain transitional work within the VA Medical Center or in the community and obtain job experience or job hardening while they are receiving therapeutic treatment. And our third program is our Homeless Veteran Supported Employment Program, which is our agency's answer to ending homelessness for our nation's veterans within 5 years. We have hired veterans who were formerly homeless or at risk of homelessness and hired them as vocational rehabilitative specialists and trained them to provide community-based supported employment to our homeless veteran population.
That's outstanding. Thank you for that.
And what are some of the other services that the VA provides in support of veterans looking for employment assistance?
Yes, Kenya. Some other services that we provide are vocational assistance, which is a group of assessment, guidance and referral and counseling that we provide to individuals and groups. And we also provide what we call incentive therapy, which is our pre-vocational rehabilitation program that places veterans with serious disabilities in various hospital assignments for job hardening as part of their therapeutic treatment.
And could you briefly explain job hardening?
Yes, job hardening is working on skills that they may be out of practice, such as coming to work on time, wearing the proper attire, taking care of their personal hygiene, and getting along with coworkers and supervisors.
Great, thank you.
And Laverne, what are the eligibility requirements for veterans to participate in the Therapeutic and Supported Employment Services program?
To be eligible to participate, all veterans are able to participate. They must be enrolled in the VA Health Administration's mental health treatment programs. They must have some type of barrier to employment that is related to their mental illness or the physical impairment that's co-occurring with the mental illness.
And how can a veteran obtain these services if they're unaware? How can they go about obtaining the vocational rehabilitation services?
The veterans may obtain services by contacting their local VA provider. There's a simple referral.
Great.
And Laverne, I know the Baltimore VA Regional Benefits Office also has a vocational rehabilitation program. What is the difference between the vocational rehabilitation program with the VA Maryland healthcare system and that through the Veterans Benefits Administration?
Well, at the Veterans Health Administration, we provide a therapeutic rehabilitative services that's integrated with clinical care. We work collaboratively with a treatment team so that we look at the holistic approach to addressing the veterans' needs. And we're not required to have a service connection in order to help the veterans.
And how do you work closely with the Baltimore VA Regional Office or the Benefits Office in the healthcare system? How do you work together to add that continuum of care for veterans?
Both administrations provide vocational rehabilitation to enable the veterans to prepare for, obtain, and maintain suitable employment. We take great strides to try to bridge the gap between services and increase access to care. We often do referrals between administrations. We collaborate on treatment plans, and we share resources.
That's great.
Is there a website they can go to or a number they can call to get more information?
Yes, we have both of our websites and numbers are located at the bottom of the screen.
Thank you so much. Laverne, I think this was wonderful information for our viewing audience, so we thank you so much for joining us today.
Thank you for having me.
That wraps up another edition of Veterans Health Watch. Thank you for joining us today. If you have questions about today's show, or you'd like to make suggestions for future topics, please contact us at 1-800-463-6295, extension 7101, or visit us on the internet at maryland.va.gov. You can also follow us on Facebook and Twitter.
And remember, if you are a veteran or you know a veteran who is not enrolled in VA healthcare services, please call us at 1-800-463-6295, extension 7324, or visit us on the web or come into one of our facilities. We love to serve you, and we look forward to seeing you next time.
See you next time.
I don't know what it's like. I don't know what it's like to. I don't know what it's like to be in a war. I don't know what it's like. I don't know what it's like to be shot at. To be shot at. To be put in harm's way. To put my life on the line. I don't know what it's like, but I do know no one comes back the same. No matter how tough you are, how brave, how patriotic, anybody can get hurt. And not just physically hurt. If you're a service member or in a military family and you're feeling hopeless, you're not alone. Please call this number. It's confidential and free. Your family needs you. We need you. Thank you for your service.